We don't often think of skin conditions as being so severe that they can affect quality of life, but for many sufferers, this isn't the case. And if you think the constant itching, scratching and infected skin, as well as sleepless nights, are tough for adults, think about how heartbreaking it can be in children. Patients attend the clinic here in the south of France for 3 weeks as prescribed by their doctor to complement medications or other therapies. In France, it's covered by their health insurance and so is provided to patients free of charge.
It started when she was 9 months old. We started noticing that she had some redness on her neck, as if she had been burned from rubbing, and then it spread to the rest of her body.
What's it like as a parent watching her suffer with the itching?
There are really two sides of it. As a parent, of course, you suffer for your kid and with your kid, and also as a doctor, I try to identify the best possible treatment for my child.
What we know about both eczema and psoriasis is that they're genetic and then influenced by environmental factors and triggered by things like a change in season, certain foods and certain fabrics.
Really, patients who listen to the advice about bathing and re-moisturising their skin properly can apply to anyone. You don't necessarily need to go to the spa.
A lot of treatments actually exist to treat both conditions, but they are in no case a cure to the conditions. What we try and do here is to try and amplify the results of a drug treatment. It is in no case a substitute to a drug treatment.
Usually the patients start with a thermal water bath because the bath is soothing effect and also anti-inflammatory, and we don't use additional or chemical product. And the temperature is also important because we have skin very inflammatory, and we limit the temperature of the bath to 32-34 degrees maximum. Also sometimes the doctor prescribe local treatment, and they have, for example, local shower on the face, on the hands, and they have also local shower on the scalp. For scars or for burn people or for different type of psoriasis, we can propose massage underwater that helps the skin to be more supple and more emollient effect. We can propose also on very fragile or sensitive skin compress of thermal water. We apply on different inflammatory lesions the compress with thermal water during 10-15 minutes. Treatment is external but also inside the patient, and we advise them to drink between 1 and 2 liters per day.
So I noticed several changes. The first change is something that is obvious that anybody can see. She no longer has any redness. She doesn't have eczema anymore. Second, she stopped itching, which drastically improved the quality of the sleep. The sleep is no longer disrupted. And thirdly, we could have expected for her to be a little calmer, but this didn't happen because that's just her personality. She's very active.
Baby has a specific treatment of 2 baths per day. And we add, after the first or the second bath, usually a compress of thermal water on the inflammatory area, on the face, on the neck, for example. What the parents tell us about their observation is that they have always to prove that their skin disorders is not contagious. At the school, at the swimming pool, for example, it's very difficult also every day to speak about that and to prove every time. And in terms of quality of life, it's very hard for them. We have a holistic approach of the skin disorders. Of course, the thermal water is the heart of our treatment, but we propose also a very large and holistic approach of the skin disorders. And also because the atmosphere here is very quiet, and the stress is one of the factors, not the only responsible of the skin disorders, but one of the factors.
Stress plays a role in not just eczema, but many skin diseases that it can aggravate them. Psoriasis is another one, vitiligo is another one, pemphigus, which is a rare skin disease. There are plenty of skin diseases that are aggravated by stress. So relaxation is a big component of how they improve, I believe, at the spa.
Now, there's a significant amount of work for patients to do once they leave the clinic in order to maintain the benefits that clinicians here claim can last for up to 9 months. And there's a cumulative effect for patients who come year after year.
So after the treatment, the patient goes home, goes back to his or her normal life, to his regular doctor. Then we try and work together. We ask these physicians to monitor the results and to see if they can maybe reduce the drug treatments that is being prescribed to the patient over time. And also during the stay, we try and offer as much advice as we can to our patients on the type of hygiene that they should have, the moisturizing hydration routines that they should have, and the kind of routines that they can have to try and improve their cutaneous or skin condition.
To explain to the kids after 3 years old to manage themselves their skin disorders, to apply themselves the cream, and with some specific idea, more like a game, because for kids it's important to moisturize, to hydrate the skin like a game every day.
Patients might buy a huge tub of moisturising cream that size and come back a month later and they tell you they've only used part of that tub when they need to be using at least that tub once a week. So really a big tub like this that you buy off the shelf, you'd be going through a tub like that a week if you were using enough of it, because it should be ideally twice a day, not just once a day. Usually it's like sunscreen, where you should leave a residue on your skin and over time it settles into your skin.
The clinicians here admit that they're not sure whether it's the thermal water itself that has the therapeutic benefit or the culmination of therapies, including hypermoisturisation of the skin, relaxation and patient education, so patients can better understand and manage their condition.
I would say to people at home, don't rip out your bathtub, keep your bathtub clean, have baths every evening if you can to rehydrate your skin. Only 8 minutes to rehydrate your skin. Buy moisturizers without any additives to them, especially fragrance, especially so-called natural plant extracts, which could have lots of things in them, and put on a lot of that so that you seal in your skin barrier. That way you won't get harmful chemicals in there that'll cause itching and irritation, set off your eczema again. And don't be frightened to use small amounts of steroid creams where your eczema is bad to heal up the inflammation.